Welcome back to the Redemption Physical Therapy Podcast. Today, we are diving into everything physical therapy. So, what actually is physical therapy? I know you may be thinking, of course, everybody knows that. Not really. Also, if you have pain, like, oh, I just need to stretch more, maybe not so much. Or, what is the difference between physical therapy and my training program that I'm already doing? We're going to get into all of that in this episode here. So, I'm Frederick, by the way, and
I'm Marissa.
so let's get right into it. So the first question is, what is physical therapy?
I think a good definition is, it's physical medicine. So we utilize movement of the body. We're movement specialists. We use movement optimization in that, in the broadest umbrella of terms, to rehab after injury, which is always the common physical therapy usage. But cool enough is that, these days we've kind of progressed into being rehab professionals in regards to injury, but also performance training, right? So we can optimize movement for your sport and your performance outside of an injury. And then also just preventative care, that type of stuff. Whereas our system tends to be a little less preventative care.
Mm,
But again, the physical therapy model is changing, and that
yeah,
is starting to be a huge priority, which is
yeah,
awesome.
yeah.
Yeah.
At least here in the Western culture, it's
Yes.
the preventative care is not so much promoted.
Oh,
But
for sure.
also want to add to that is if you think about disease processes, right?
Hmm.
So other diseases that you can potentially have that may affect your musculoskeletal issues or system,
Hmm.
um, we treat that as well.
Hmm.
Um, but we treat it without surgery
Yeah.
or drugs.
Hmm.
That's our purpose here. Like we're treating these things without surgery or without the use of drugs. So if you're a person who has some type of issue that requires fine motor movement um, to be corrected, or if you're a person who has some type of knee pain or shoulder pain or whatnot, and you want to do that, recover from that without any surgeries or drugs, physical therapy is the right way to go. Okay. So you try that out for a period of time because sometimes, yeah, when worst comes to worst, you may actually need to have surgery. But in a lot of cases that we've seen, you don't need surgery or you don't need the drugs. And sometimes the drugs kind of mask the healing process
Hmm.
and what may be making it worse, as well as surgery, because you can get the surgery but never actually address the root cause. But we get into all of that in other videos if you want to go back and watch those. But just kind of giving you a little overview of what we actually do in physical therapy. Okay. So the next thing is, what is the difference between working with a physical therapist and a personal trainer or strength conditioning coach?
Yeah, so I think it's kind of the scope of practice and the level of education, right? I think, that's not to say there's great personal trainers out
What you
there.
mean?
There's,
I'm educated. What you talking about?
I'm educated.
I'm educated.
So yeah, there's great strength and conditioning specialists out there. There's great personal trainers, and a lot of them are devoted to continuing their education
Yeah.
outside of their cert, which is awesome. Um, I think like I said, the thing that sets us apart is just the education that we go through in school. Not only are we masters of anatomy, we're masters of movement. I think we're kind of like top of the food chain when it comes to being like movement specialists,
Yeah.
right? And movement optimization specialists, those type of things, especially pain, right? We learn a lot about pain science and those type of things, biological healing and those type of
Mhm.
topics in school. And that's a big separator when it
Yeah.
comes to PTs and personal trainers or strength and conditioning coaches.
Yeah.
Just that pain tends to be outside of the scope, and we can better address pain, even though it's not the only thing that we do in
Right.
PT,
Yeah.
right? But yeah, that's kind of we're better equipped to handle that.
Yeah. And then I think it's good to understand too, like just the difference between in every profession, like there's good and there's bad.
Yeah.
Or good, great, good, bad.
Yeah.
um,
Spectrum.
right. There's a spectrum there. Because, there are physical therapists who may be in outpatient and they're working with athletic people, but they don't really know like what goes into their training.
Hmm.
There may be people who work out and then they're getting physical therapy from somebody who actually doesn't work out.
Yeah.
So it's just like, are they actually best qualified for me to go to at this moment while I'm in pain? Yes, because that's their scope. But when I get out of pain, I need to get either a good strength and conditioning coach or a good personal trainer that really hones in on movement, does an assessment.
Yeah.
if if your therapist, if your personal trainer, if whoever's working with you to do your movement is not assessing you, oh my
regularly.
goodness. Oh my. Okay, that's this. But just know you need to be assessed
Yeah.
because that's like pretty much, oh, I'm gonna run a 5K, but you don't even know whether or not you can handle that duration, or if you have some type of hip issue, or you got some type of knee issue or whatnot, or oh, is my ankle range of motion good enough? Like, what? You're just gonna get off the couch and just go into the 5K? No. Obviously, you're gonna be like, okay, let's see how far I can run without getting out of breath. You assess how far you can go, and then you judge whether or not you should be doing that or not. But anyway, sidetrack. Um, yes, the level of education and also the scope of practice between those two areas are a huge thing when it comes to the difference between physical therapy and personal trainers and strength conditioning coaches. All right. So the next thing, what about chiropractic care? So what's the difference between a PT and chiros?
Cairo. So, I think this people are probably laughing, like, it's like an infamous, enemy thing,
No,
which
we're not
yeah,
enemies.
I don't see it that way. So, same thing. Like, there's good and bad in everything. There's
Yeah.
good PTs, there's bad PTs, or good, great, great, whatever.
Yeah.
There's good Kairos, there's bad Kairos. So yeah, and Kairos um tend to use more like specific manipulations, right? So they're very good with those, like actually like manipulations, cracking, right?
Yeah.
They're very good with specific manipulations. And they at least from what I understand of chiropractic care, there's also like a heavy like kind of neuro background in the sense of like how the nervous system
Is it?
interacts with
Yeah.
everything,
Hmm.
right? Which of course we do as PTs too, but like I said, they're a little heavier in regards to how the neural response and the nervous system responds to manipulations and things like that.
Yeah.
And again, I tell everyone because I'll get this question like, well, what do you think about Kairos, right? I have no problem with Kairos. I
Yeah.
actually, work very closely with a couple Kairos, because they're like-minded, like
Yeah.
me. Studies are great for manipulations. They show that they can be very, very effective if you follow them up with exercise, right?
Hmm.
So if you're a Cairo that's got 10-minute sessions where you're cracking and they're done, like I have a problem with that. You know what I mean? Because that's not evidence based.
Cracking and stacking.
Yeah, exactly.
Cracking and stacking
Stacking
that
cash.
money.
Yeah, yeah. I have a problem with that,
Yeah.
But
Yeah.
the chiros that I work closely with are they do a really good job with movement as
Yeah.
well. They crack or if they need it. And that's the other thing. Like some of the chiros I work with, not all their patients get adjusted.
Yeah.
You
Yeah.
know?
I've seen that in the clinic that I work at too.
Yeah,
Yeah.
which is great. I mean,
Yeah.
not everyone needs it.
Hmm.
It is a very effective treatment. But I digress. Like I
Yeah.
said, the chiros that are good know the benefit of coupling exercise.
Yes, 100%. Because it's one of those things like if you're out of alignment per se, right? It's the manipulation can definitely help get things where they need to be, right? But the exercise is going to let it stick,
Hmm.
make it stay where it needs to be. But then there's also the other end of the spectrum to where you can do exercises to get everything where it needs to be. Because
Hmm.
sometimes it just could be overactive muscles, underactive muscles, how your body is actually stacked when you're doing certain things.
Yep.
If you've had repetitive movement patterns in your sport, hobby, or your job
Hmm.
that pretty much changed up the way that your body sits. And it's not always a bad thing, right?
Yeah.
Because sometimes that actually makes you better at your sport,
Hmm.
your hobby, or at work. It
Right.
makes you better at those things. And if we kind of take away those things, then that could pretty much make you worse at your
Yeah.
sport or hobby. But it also depends on the specific thing that you're indulging in. Okay.
Yeah.
But just know that, the difference between like those two things, like manipulations more so for the kairos and the adjustments or whatnot.
Yeah, I
But
mean they're great at like I mean we learn manipulations and we can do
yeah.
them. Like I like to say that they're probably way more comfortable because they do it
Mhm.
very often, right? And
Yeah.
I think they're very precise. I'm talking about the good kairos, right? Right? But like you said, like they also just have an appreciation for the fact that a good Cairo doesn't tell you that you're out of alignment,
Right.
right? A good Cairo
Yes.
doesn't say like
Yes.
that your back is subluxed, right?
Yeah.
It's likely not the case. They understand the nervous system response to the manipulation.
Yeah.
They're not popping a joint back into place.
Yeah.
They're getting a nervous system response, which allows, like you said, exercise afterwards and blah blah blah.
Yeah.
That's what a good Cairo does.
Yeah. For
Yep.
sure. For sure. Um, all right. So, what treatments are provided during physical therapy?
A lot of things, right? So,
Yeah.
I mean, again, we're movement specialists.
Mhm.
So, yeah, exercise is a huge part of at least what we do at Redemption, right?
Yeah.
A huge part. And that tends to be corrective exercises,
Mhm.
mobility exercises, therapeutic exercises, which we'll
Mhm.
get into a little bit later. But then we have the manual technique side of it,
Yeah.
right? You know, we do manuals. Like there is a lot of manual stuff we do. Joint mobilizations, cupping and scraping, dry needling, those type of things are all implemented as well to those who are appropriate for them and to those who are going to benefit from it.
Yeah.
You know, not everyone gets everything
Yeah.
because it's not beneficial to do everything.
Yeah.
Yeah, but
Yeah.
that's, exercise is king.
Like it. Yeah, for sure. And like how a lot of people might want to come in and at least I used to get this in the clinic, just like, where's my massage? Just like what these
Yeah.
spirit fingers here, they're not for everybody.
Yeah.
Okay. Only the people who really need it at that time.
Yep.
And if I feel like it that
Yeah, yeah, right. That too.
day.
My hands are tired.
Right. All right. So that leads me into, so what is manual therapy? Because we say that often in physical therapy. It was just like, yeah, we're gonna do a little bit of manual therapy on you. And
Mhm,
people are just like, huh?
mhm. Yeah, I mean, I think the best way to get people to understand it's like me utilizing my hands
Mhm.
to elicit some sort of response. You know what I mean? Or the assistance with tools as well. You know what I mean?
Mhm.
Like I would put like cupping and scraping like under
Manual
manual
therapy.
therapies in
Yeah.
a sense, right? But soft tissue mobilization, scraping, even dry needling. You know, where I'm utilizing my hands to elicit a response or whatever, for whatever benefit for that client that
Right.
I intend.
Right. And what could be some of those benefits of manual therapy?
Yeah, so I mean, you get a lot of we used to think that like certain things would like literally stretch a joint capsule and stuff like that. Like probably not the case. Like we've learned over the years that like actually creating structural deformation of like an actual joint like per se is not we can't induce that type of
Yeah.
of stress.
Yeah.
But what I can do is elicit a bunch of chemical releases. I can elicit deformation of like the muscle, which creates a bunch of chemical releases, which
Yeah.
can result in muscle relaxation if
Okay.
that's what I'm going for. It can result in improved blood flow to the
Mhm.
area, which is healing if
Yeah.
that's what I'm going for. With the muscle relaxation, maybe I'm going for a mobility change. So if I
Yeah.
can get that muscle to simmer down
Nice.
around the
Nice.
joint, then I can move that joint through a less painful range of motion.
Right.
The needling gets real in depth in regards to what it does, but
Yeah.
at surface level, blood flow, symptom modulation, aka pain relief, tissue relaxation, trigger point release, those type of things, healing, tissue healing, all those things.
Got it. All right. So the next question is, what is the difference between therapeutic exercise and my normal workout? I already work out. Why do I need physical therapy? I got pain. Yeah, I got some knee pain or whatever, but I'll just do some more exercises like that I'm normally doing. Why
In
do I
your
need therapeutic exercise?
So I think it boils down to that root cause that we talk about all the time. You know what I mean? So and don't get me wrong, there's overlap. Like
Hmm.
I use some of your typical exercise
Yeah.
routine exercises in my therapeutic exercises, but
Hmm.
the intention is to correct something for your root cause. You
Right.
know what I mean?
Yeah.
So, like we were talking about in a different episode, RDLs, they're a great posterior chain strengthening exercise, whether you have back pain or not, right?
Yeah.
They're great. Again, here's the overlap. RDLs can also be a therapeutic exercise.
Hmm.
Maybe we just worked on the back.
Yeah.
We got a ton of blood flow to the back, and now I want to activate all those muscles. We can do RDLs,
Yeah.
and then it becomes a little more of a therapeutic exercise. It's
Hmm.
specific to that person.
Yeah.
It's specific to their root cause problem, and it's got a specific intention in regards to their physical therapy program.
Got it.
Mhm.
So we kind of hinted at this.
Mhm.
What is dry needling?
Mhm. So dry needling, I say it's similar to acupuncture, but it is not
Hmm.
acupuncture, right? So I actually use acupuncture needles, like so
Hmm.
those tiny thin filament needles. Um, Whereas acupuncture goes into what we've heard as like energy channels or the chi, right?
Hmm.
Dry needling is more or less going into anatomy, right? For example, if I have someone coming to me and they've been working at the computer and their traps feel super tight and they feel like they got all these knots, like I'm needling into the trap muscle, right? And of course, there's a bunch of landmarks that I've got to use and stuff like that. But I'm literally putting the needle into the muscle tissue. That can go into a ligament, that can go into a tendon, that can go, you know what I mean, down to a bone, right?
Okay.
Believe it or not. But yes, that's what I'm using the anatomy as my energy points, right?
Okay. Yeah.
But yeah, what does it do? Like we talked about, it brings a ton of blood to the area for tissue healing. It can help with tissue remodeling because, again, as we bring blood to the area, it's also bringing remodeling agents, taking out the bad, bringing in the good. There's a big symptom modification or modulation piece, whereas I'm decreasing pain, that type of stuff, tissue relaxation, specific trigger point release. There's so many things. Yeah,
Okay.
the dry needling course that I took, it was extensive in
Yeah.
regards to like pain science and stuff. Yeah,
Got
it
it.
gets nerdy,
Yeah.
but for you guys, that's what it does.
Good. Good. All right. So the next modality that we're going to talk about here is like, what is red light therapy?
Red light therapy, yeah. So it's probably one of my least used things. However, red light therapy, again, not to get too nerdy, like it uses like a specific wavelength, right?
Yeah.
We all know light has wavelength.
Hmm.
So and the studies have shown, or the research behind it shows that like that specific wavelength helps to basically increase the energy in the cell, like this ATP. I don't know if anyone's ever how nerdy that is. It's basically the cell's energy,
Mhm.
right? So it increases that ATP in the cell,
Okay.
and with more energy, the cell is able to function better. Whatever that cell is responsible for, it's able to function better. And a lot of times, it's like this healing aspect that we are using it for.
Got it.
Yep.
So what is eSTEM? So instrument assisted soft tissue mobilization, or as we usually coin it, scraping.
Scraping. Yep. Yep. I tell people like it's basically soft tissue mobilization that I would do with my hands. Like
Hmm.
it's the same principle in a sense.
Yeah.
But I use a metal tool,
Hmm.
right? Why do I use the metal tool? It depends. You know what I mean? Like sometimes it's just based off of like the severity of what I'm dealing with in
Hmm.
regards to like maybe the type of muscle, the tension in the muscle, whatnot. It allows me to maybe to get a little deeper than my fingers can get,
Hmm.
depending. Or it could just be, and I'll be honest with you, it could just be a day where I'm trying to save my thumbs or
Yeah.
save my hands. Like it's also a tool for us for longevity in our
Yeah.
in our career.
Yeah.
You know what I mean?
Definitely.
But yeah, so what does it do? It brings blood flow to the area, like we talk about all the time.
Yeah.
Can it help to break up adhesions? Some studies say yes, some studies say no, but
Hmm.
it depends.
Yeah.
But again, I think the blood flow part is the key
Mm.
to the scraping, and it can help with relaxation as well.
Gotcha. Yeah. So getting into the next one, what is cupping?
Cupping.
Yeah.
Yep.
I mean, most people have seen cupping,
Yeah.
but what does it do and why do we use it in physical therapy?
So cupping is kind of cool because it's different than most of the manual techniques that we use. And it is because so we think of soft tissue mobilization. We think of scraping. We think of those mobilizations where I'm using my hand on the joint. Those are all kind of compressive in nature, right?
Hmm.
I'm compressing, I'm pushing into the tissue, I'm scraping, I'm pushing into the tissue, I'm mobilizing, pushing into the tissue. Whereas the cups are decompressive in nature. They're lifting, right? So, I mean, again, the principles are fairly similar. It's still increasing blood flow to the area. I love to use cups with movement. You know what I
Hmm.
mean? Like I'll put them on a certain body and then I'll get the joint moving, and it helps with gliding because it's now I'm suctioning the layers of the tissue and then I'm moving them. So I'm kind of assisting this gliding motion
Hmm.
between all the fascial layers, the muscle layers, the skin layers. We should be able to glide. We shouldn't be sticky,
Hmm.
right? But I love to use cupping with movement for that reason. But yeah, it is different because it's a decompressive technique versus a compressive technique, which is pretty much all of our techniques,
Yeah.
if you think about it.
Yeah. Yeah.
Yeah,
For sure. Got
yeah.
it. So some people might ask, all you guys do is just massage. But if you're watching this, if you made it this far, we don't just do massage. So why can't I just go to a massage therapist?
So I think certain recovery techniques, yeah, I mean, a massage, like there is overlap. You know what I
Yeah.
mean? Soft tissue
Yep.
mobilization, yeah, there's a lot of overlap, and there are great massage therapists out there.
Hmm.
I think it kind of goes back to some of the education level as well. You know
Yeah.
what I mean? Are they equipped to treat certain types of pain and whatnot? Maybe, maybe not. You know what I mean? I think that the pain science education that we get is important. Plus, I think the addition of the movement optimization that we do as PTs sets us apart from massage therapy.
Hmm.
You know, whereas massage therapy could be great for decreasing a muscle or whatnot, which might short term improve mobility.
Hmm.
In order to get those long term effects, there has to be some sort of like corrective movement base,
Yeah.
which is what sets us apart.
Yeah, definitely. Because I've seen this plenty of times where just like, people go and get a massage, they feel better for, a little bit. And then, you know, they get right back to it,
Yeah.
right back to that pain. And oftentimes the missing link is active movement, the
Hmm.
therapeutic exercise.
Yep.
So it's like, yeah, we can, we can reduce the pain because the stiffness is gone because of the relaxation from the massage manual techniques and all that other stuff. But if we don't reinforce that with something, then, it's all for nothing because
Yep.
we're just going to be right back in that cycle. Um, so yeah, this is mainly for people who, oh, and then also addressing the root cause, because if you go in again and you get that massage, it's only addressing the tightness and the stiffness. And I've actually met a massage therapist who actually did an assessment on me and just saw like, okay, this area, that area, just like actually did a full assessment to let me know what areas were kind of off and what
Yeah.
I need to work on. So I'm just like, okay, never seen that before. But if you just go in and you're just like, oh, this is tight and I want to get that worked on, then you're not really addressing your root cause,
Right.
and you can just be coming back for really a issue that can be resolved by maybe doing that soft tissue work, then doing some therapeutic exercise
Yeah.
to figure out to get rid of that root cause issue. And then all of a sudden you don't have that issue for, let's just say, a more extended period of time, right? Instead of every month you have to go in, now you're just like 3 months out and you still haven't had that flare up or whatnot.
Yeah.
So yeah, I think that's another huge part. The of course the level of education there, but the movement, the actual physical movement, and addressing the root cause.
Yep.
So because we do so much movement, people will be like, "Oh, so is physical therapy painful?
Hmm.
Because I'm already in pain. Why are we moving more?"
Right. So I think yeah, there's techniques that can be uncomfortable for sure, you know, and I think that again, this is where like some of our education comes into like, you know, how much discomfort is okay and isn't, what type of discomfort is okay and isn't, those type of things. Knowing in regards to biological healing or post-op healing and stuff like that, knowing the healing that occurs, the time frames, those type of things can help us to better guide clients through the painful process, you know. But yes, there is some discomfort when not with all therapy. You know what I
Yeah.
mean? No, not at all. And we are cautious to supervise it,
Right.
right? But
Yeah.
yes, I'm not gonna lie. Sometimes it's uncomfortable,
Yeah.
you know. But
Yeah.
so is like yeah, a hard workout, you know,
Yeah.
and we don't see that as bad pain,
Right.
you know.
Right. Yeah. Exactly. And it's a lot of times it would you could go two parts of it. Like the people that might ask this question are the people who may not be as physically active, right?
Hmm.
So they may not be as physically active, or they may not even really push their workouts to where it's just so hard. It's just like, oh, I got a nice little sweat in. I feel good.
Yeah.
Uh,
Yep. Yep.
so and then they get an injury and they have to go to physical therapy, or they're scared because they're like, oh man, there's movement in there. And I always say like, hey, it's okay. I'll modify based on like your pain tolerance, because that's a big thing. If they're already nervous about coming in and moving, it's just we're gonna keep it as easy as we possibly can in order to, one, make you feel comfortable, make you feel okay, and let you know that movement is fine.
Mhm.
Also educate you on that. Hey, there might be a little bit of discomfort, but we're not gonna push that discomfort.
Right.
Other end of the spectrum, the hard chargers,
Yeah.
the one who work out so hard to where their body is in shambles, but they keep pushing.
Yep.
Um, but them, they're just like, oh yeah, like nah, I got a really high pain tolerance. Like you can get deep in there,
Yeah. Like there's not benefit.
you could push really hard. Just like no, 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 no. Or I'm just like do this exercise, and they're just like yeah, no, it feels fine. Just like okay, give me a pain scale. Well, no, I mean, I feel discomfort. It is about an 8 out of 10. I'm just like, okay,
Yeah, yeah, you gotta pull the
pull it
reins.
back.
Yeah,
Pull it back. Because we're not trying to create more inflammation in the area or less bad inflammation. We're
right,
not trying to keep that inflammation elevated.
right,
We
yeah.
need that area to heal.
Mhm.
So it's two ends of the spectrum. If you're more fearful, speak to your therapist about that,
Mhm.
and have them guide you through something a little bit more scaled back. Uh, but just know that there is some discomfort, but you have to get through that discomfort in order to get to the other side of pain,
Mhm.
right? So out of pain, and that's just part of the process. Because if you don't move, you may be in pain for even longer than you would like. So push through a little bit of pain
Yep.
in order to get to the other side of pain. Okay. And for those who like to push a little bit harder and just try to get out of pain as quickly as possible by putting yourself in a lot more pain, pull it back,
Mhm.
scale it back. All right. So the next thing is how long does physical therapy actually last?
Hmm.
It
Well,
depends.
yeah, it does. So it depends, and and two kind of different answers. It does depend. If you're coming to physical therapy for some sort of injury, whatnot, yes, depends on the injury, depends on the location, depends on the severity, depends on if it's post-op or not, right? My second part of this answer is the change in the model, right? So physical therapy can last forever, right?
Yeah. Yeah. Yeah.
Right,
Right.
so
Yeah.
where we can be preventative, we can be there for you if you do end up sustaining an injury, we can be there after injury when it's just a performance, or hey, you just want to move well for the rest of your life.
Hmm.
You know what I mean? So the model is changing, which is cool, and allows us to say, yeah, you can use physical therapy forever,
Yeah.
just like you would the gym
Yeah.
or your personal trainer, so that's kind of, I think, is probably the better answer in regards to staying progressive with the model.
Right.
Yeah.
Gotcha.
Yep.
And in regards to a specific injury, just kind of expand on that. Like, how long does the therapy process last? How long do I have to go through this physical therapy treatment?
Yeah. So, even if it's, let's like, you break a bone, tends to heal in, 4 to 6 weeks. You tweak a muscle, probably will heal in 3 to 8 weeks, right? And I'm giving these like kind of arbitrary numbers. I'll have a point in a second. You come to me for you sprained an ankle. Again, I don't know, 3 to 8 weeks, depending on how bad it is. Most things are going to heal in kind of that 4 to 8 week range, in a sense, or at least the healing process is going to be initiated,
Mhm.
right? Afterwards, it's those months afterwards that are super important and that people tend to forget, because it's like, well, I'm out of pain,
Mm,
feel good, I'm done, right?
yeah.
I would say, like, if I'm going to give an umbrella, like how long you should be in PT after an injury, it should be, for simple injuries, we're going to say 2 to 3 months. For more complex or severe injuries, you should be thinking in your head like 6 to 8 months, right? Because not only are we getting out of pain during that time, we are restoring whatever range of motion, strength, we're restoring it back to normal. And then we are building on top of that, which is where we get into your root cause, like why it may have happened. We're building on top of that to remodel the tendon or the tissue to normal, as well as hopefully decrease your risk for injury in the future.
Mm,
Right? So
yeah.
there's like 3 phases to your
Yeah.
rehab.
Yeah.
Yeah.
Got it.
But I'd say even a simple guy should be 2 to 3 months,
Yeah.
at
Yeah.
least.
At least. Yeah.
Yep. Yeah.
Definitely. What about injections? Getting into this, will that fix my problem?
So, yeah, we think of like cortisone. A lot of people, when they think of injections, they think of cortisone injections,
Okay.
right? Um,
What are cortisone injections?
Cortisone
Sort of.
injections, what specific cocktail, right? But
Yeah.
the doctors um market it as it decreases inflammation.
Okay.
So they put it right into an area, and
Okay.
it reduces inflammation of an injured area. Couple problems with corticosteroid or cortisone injections is, one, they're 50-50. I mean, some people get relief from them, other people don't, like immediately the next day there's no change. Some people get a week long relief, the other people don't. Like, they're just 50-50. They're all over the place. The second problem with them is they're a band-aid, they're a mask, right?
Mhm.
So yeah, you can decrease inflammation and make it feel better, but like didn't fix what actually is going on in there, right? Because the inflammation's not what is going on. Like it's a response to what's going on,
Yeah.
right? So it didn't fix any of that. So you're just masking this pain, which puts people at increased risk for injury because God forbid that mask lasts for 3 weeks and they go back to weight training or weightlifting or something like that and
Mhm.
they further injure the area,
Yeah.
right? The other problem is that they have a tissue eating characteristic.
Mm.
You know what I mean? Like if you get multiple cortisone injections in a specific area, there it starts to like degrade the tendon and the ligaments in the area,
Mm.
which can result in a rupture at some, which has resulted in you see some of these things. Yeah, so it starts to eat away at the tissue, and can result in a way worse injury. Yeah.
Mm.
So I don't recommend them. If ever, honestly.
Yeah.
Yeah. I just wouldn't. I wouldn't risk that. The risk to benefit is terrible.
Gotcha.
Not worth it.
Yeah. So there you have it.
Yeah.
Will that fix my problem? No.
No, I don't think so.
And you hopefully, for people who do get them, they're hoping that they are on the other 50-50 of that side, of the
Right.
50-50, the side that it actually helps them for the time being.
Yeah. For the short time until it
Yeah.
wears off.
Right. All right. So the next question here is just like, can't I just stretch more? I hear this often. So I'll kind of jump in on this one
Yeah.
because a lot of people are just like, yeah, my shoulder hurts a little bit. I just need to stretch a little bit more. Yeah, I just got like a little knee pain. I just need to make sure I stretch before my workout's a little bit better or whatnot. Or people who come in who don't work out at all, and they're just like, yeah, I think I need to start doing a little bit more stretching because I haven't. I'm just like, stretching is the end all be all, isn't
Yeah. Gold standard.
it? The gold standard. So I'm not mocking you guys. I'm just laughing because I know that that's not the issue here. Because there are plenty of people who are actually very mobile, mind you. That excessive mobility comes at a cost of stability,
Yeah.
right? And that can literally be the cause of your injury,
Correct.
right? A lot of times I've seen it with people who have that excessive mobility. If they get any type of muscle tension now build up in that area, they're just like, oh, I'm tight. My hamstring tight. But then they can still touch the floor with their hands.
Hmm.
They can still put their head on their knees when they're doing a forward bend. And I'm just like, no, your hamstrings aren't tight.
Mm-mm.
You're just getting some muscle tension in that area now, which is reestablishing some stability that you need
Yeah.
to actually help prevent any type of injury that may be caused by that instability that you have going on. Now, somebody who can barely like reach over and like touch or scratch their back, then maybe they might need some mobility work or whatnot.
Yeah.
But again, sometimes it's not the stretching, it's not the mobility. Sometimes it's a stability issue that they need that's causing their issue in the first place or causing them to feel tight as well.
Right.
And then other times, I'm not a big fan of static stretching.
Yeah.
Not a big fan of static stretching. I'm more of a dynamic mobility, actual movement, actual movement. Do movements that you feel the issue in. Do those movements in a controlled manner. Do those movements in your workout, isolate it from speed, isolate it from heavy loading, and see where things are a little bit shaky or a little bit off. Instead of just jumping straight to stretching, because
Hmm.
stretching can just really just mask another issue. You may feel good for the moment, and then all of a sudden the pain comes right back.
Yeah.
Or it just may predispose you to even a more serious injury, just stretching away day after day. But yeah, that's my take on that. Can I just stretch? No, you can't just stretch. I'm just gonna keep it black and white. No, you can't just stretch. If you do stretch, make sure you reinforce that with some type of stability. Okay, if you do decide that you enjoy stretching and doing all that stuff, I'm not gonna just kick you to the curb. Do some movement stacked on top of that. You got
Yeah.
anything to add to that?
No, I agree
No.
100%. You especially shouldn't be stretching before working out,
Yeah. Yeah.
like
Yeah.
static
Yeah.
stretching.
Yeah. Yeah. Don't do that.
Yeah.
Do- don't do that. Dynamic movement.
Yeah.
Dynamic movement before your workouts. Okay.
Yep.
We're just gonna keep that playing. All right. Again, if you're a person who likes to stretch, oh, but I should be stretching before my workouts because I'm just tight. No, dynamic movement. Okay. Next thing, should I avoid resistance training now that I'm injured? Now that I have an injury, I guess I can't work out, right?
Yeah, I mean that's kind of what the model tells us, right? um no, I think like, if you guys have watched any of our podcasts, you know that we are huge advocates for injury or not, you maintain movement, right?
Mhm.
That can still be resistance training. We can modify so many things. And again, right, we've talked about this. You have a dislocated C1 in your neck. Oh, like, okay, like there
Yeah,
is a time and place, right? So
let's be
don't
serious
comment
here.
that. Cheese and rice.
What about those people who
Yeah,
okay,
yeah. Like, okay, oh, the outlier. Okay,
no shit, Sherlock.
yeah.
No shit.
So for most
Chill.
things, right? Yes, for most things, we can modify so many things, like resistance training. Like we can modify the load, we can modify the volume, we can modify the type of load. Maybe
Yeah.
we're not getting under a barbell, we're using some bands or something
Yeah.
like that. Like, we can modify the body part. If I have a real shoulder problem, well, then I can still work lower body.
Yeah.
You know what I mean? Like, what's preventing me from doing that?
Mhm,
So
mhm.
yes, no, you don't stop resistance training. Yes,
Yeah.
you might need some guidance on modifications, and that's what we're here for.
Yep.
But no, you don't stop. You don't stop. And I mean, there's even a really, kind of side note, a really cool phenomenon, like when you have like an injured side, like
Yep.
training the other side, because all of the neural pathways, they tend to crisscross, right?
Mhm.
So training your good side can actually help to kind of maintain a little bit of like integrity and contraction on the other side without even using it,
Yeah.
right? The neural pathways will help to just kind of maintain. It's just like this cool phenomenon that the body does. So like, we can even just, if we can't use this arm at all, cool, we can still train the other side, right? And isn't that gonna create imbalances? Not Probably not in the time frame that we're doing it.
Yeah.
Over a year, yeah,
Yeah.
probably.
And
But hopefully we
hopefully,
can use
yeah.
that arm at that point. Jeez.
Yeah.
So no,
Yeah.
it's not going to create imbalances in the time frame that we are intending it to be.
Yeah, exactly. It's like imbalance. Oh no. It's just like, oh, I'm gonna disappear on this side and
Yeah,
then I'm just
right.
gonna have this pop-out arm on this side.
Yeah.
Oh my gosh.
No.
But no, I
We
get it
got you.
because I would think about the same thing too. Just be
Yeah.
like, well, nah, you can still train that, build that up. Because what if the side that you injured was your weaker side? Now you get a chance to actually isolate it.
Yeah.
Because I mean, you could think about injury as a the chance to actually improve your performance in the area that you were neglecting because you only trained the area that you were really good in.
Yeah.
As now it's just like, okay, all right, now I can, because I remember what was it, Brent Fikowski, that year that I forget what he injured. I don't know if it was something lower body, but then he had started training upper body a lot. I believe it was the upper body he had started training a lot. And then he had got really good over the course of that injury, and then that helped propel him to the next level.
Yeah.
I might don't come at me if I butchered that whole entire story, but it's just a point of that can push you over the top. Even if you think you don't want to look at that injury as a setback, you want to look at it as an opportunity to make progress potentially in another area of training, your sport, hobby, or just in life in general,
Mhm.
right? So, all right, now I take a step back in this area, but I'm still going to tackle my injury in this manner. Maybe I can approach training a little bit differently moving forward, and then also maybe I take some steps back in the gym and now I'm addressing another area that may need some attention. Maybe it's my nutrition, maybe it's my lifestyle things, some stress management, some sleep or whatnot. Look at it as an opportunity to fine tune some other things as well.
Mhm.
Um, because that's huge. Again, so we're talking about like, should I have to stop working out now? It's all about like thinking about what you can do and not what you can't do anymore. Because we want a mindset of like growth, instead of just like looking at the negative,
Mhm.
glass half empty, glass half full. Let's look at the glass half full. All right. So should I avoid? Oh, no, we just answered that. So the next one is, why am I not getting better? I've been in physical therapy now for, let's just say, a whole entire month. I'm not getting better.
Mhm.
What's going on here?
So I think there's a lot of answers, quote unquote, to this question, right? Number one, like, are you allowing the time? Like, are you being patient? Things, especially things that you've been dealing with for a year, they're not going to resolve in 4 weeks. It's not going to happen. Well, can they improve? For sure. For sure, right? But you've got to be patient. You have when we talked a little bit about time frames, even the simplest of things are going to be 2 to 3 months. Like the simplest,
Hmm.
okay? If you've been dealing with something for 2 to 3 months, may not even be simple anymore,
Yeah.
right? So you have to allow time. Like we are very impatient creatures, I
Oh
feel
yeah.
like. Some of us have mastered it better than others, but you have to allow time. The other thing I'm looking at, I'm like, hey, are you being consistent? Like, are you doing what I'm telling you to do? Right.
Yeah.
I'm not saying like I'm your babysitter, but I'm saying like, hey, are you actually doing the exercises 3 times a week? And are you doing them with good quality?
Yeah.
You know what I mean? It's not, you can't just check the box with
Yep.
these things. They have to be done with good quality, with controlled speed, these type
Mhm.
of things. I can't just be like, oh, yeah, I did them.
Yeah.
Yeah, it's like that doesn't count. So that you can
Yeah.
just cross that off as what you did that week because you didn't do it.
Mhm.
So are you being consistent? We talk about that all the time. Consistency is so important. The other thing is like, are you modifying your other training? Right? If we're
Yeah.
doing all these exercises and you're doing it really well, cool. I'm proud of you. Doesn't matter if you have done nothing to change the volume or the frequency of what's causing the problem. If squats are the problem and you're still squatting 6 days a week, we can only do so much, y'all. You know?
Right.
So it's like, and again, that kind of comes with, as I know I do it, but your PT should be structuring that. Like,
Yeah.
hey, listen, we are going to reduce your squats to 2 days a week,
Yeah.
right? And then we might have to play with it. Like that might still be too much, but we have to try it out for a
Mhm.
certain amount of time in order to figure that out,
Mhm.
right? And I think the last piece to this question is like your lifestyle.
Yeah.
Like, oh, yo, I'm not getting better. Okay, are you sleeping?
Yeah.
Yeah. How's your diet? Are you stressed out? Are like all these, and we've talked about these on other episodes, like
Mhm.
lifestyle factors play a role, which is
Mhm.
kind of cool where we come into play as like, I say cash based PT, but like, because I can sit down and have these conversations. Like, I remember working in the insurance based world, and I'm like, how often did I ask about sleep?
Mm.
I didn't. What I did ask, like, do you have pain while you're sleeping?
Yeah.
Okay, cool. I mean, that plays into it, but not like, how the hell are you sleeping?
Yeah.
Like I never dug into that because I just didn't have time for that.
Yeah.
Right. But it's important,
Yeah.
So like if you don't think you're getting better, like what does your work stress look like?
Yeah.
What does your sleep look like? Are you eating McDonald's every day?
Yeah.
These are all playing a role,
Yes.
huge role.
Yeah, I am a big proponent on the lifestyle stuff.
Yeah.
Goodness gracious, it's all holistic.
Yes.
We think of it as like it's one big puzzle piece and we put all the pieces together. But yeah, so those things affect your rate of recovery outside of that because if you're not sleeping, you're not rebuilding. If you're not sleeping enough, you're not getting as much of that rebuilding process as possible. If you're
Yes.
not eating quality food, you're not getting the building blocks, enough of the building blocks, the vitamins, minerals, the macronutrient that you need to build back up that tissue specifically in order to mediate the healing process. If stress levels are high, that's another thing that breaks your body down. And if you're not in a state to where anabolic state, we like to call it, but of low stress, and of course, you don't get rid of all stress, but if we're chronically stressed in all these areas, that leaves no room for building back up. And it just takes more of our resources from that. So stress is huge and it's often overlooked because I'll get some patients that come in and my manager at work is hounding me and it's a stressful situation at work. It's a stressful situation at home. I barely get any sleep. Yes, I eat fast food. And I'm just like, now wonder why you're still in pain.
Right.
We're not building back up from anything.
Yeah.
Right now, we're just in a constant breakdown state. So we have to make some changes. Sometimes it could be hard conversations. Go ahead.
Yeah. Another huge one, and like, don't hate me, but alcohol consumption.
Yeah. Nah, I mean, it's
It's
real. Like,
huge.
it's real.
And I'm not blaming any, or I'm not
Yeah.
accusing anyone of being anything, right?
Yeah. Yeah.
But
Yeah.
if you're having a couple beers at dinner every night and you have chronic back pain, I can assure you that your chronic back pain is because of that.
There's some correlation here
Yeah.
between your drinking and your back pain. So
Yes.
let's
Yes.
address that, okay?
It's
Um,
huge,
yeah,
unfortunately.
no, for sure. Because just understand that alcohol is a stressor on the body. Point
Yeah.
blank, period. Just understand that. Even those people that say that it kind of winds them down, understand you're just doing a band aid. We always talk about this, that, injections
Mhm.
or maybe just stretching or whatnot, um, or just resting or icing something. That's always just a band aid, right? So, with the physical things, right? So, when we're thinking about recovery and pain and getting out of pain and why you're not improving, is if we're not addressing the things that are also stressing our whole entire system out. And alcohol is a stressor to the system, regardless of if at the point in time you ingest it, you feel a little more relaxed. You're still causing stress to the body. Yes, mentally, you feel more relaxed, but you still didn't address the actual issue. So, in that, we're not gonna get into like dive into, okay, well, let's sit down and have a talk. So what's going on in your life that we need to make some adjustments for? We're not gonna sit down and talk here about that, but just understand there needs to be some adjustments there and understand when you're actually putting a band-aid on the actual issue here. Okay.
Mhm.
Um, last thing. So, what do I do if my pain comes back? So, I've had physical therapy for about 8 weeks, or like you said, those three months or whatnot. And I feel good now. I'm getting back into training. My pain came back. What happened there?
Mhm.
I got knee pain again. What's the deal?
So I think it's like again, it's kind of multifactorial, right? So number one, recognizing and appreciating that the rehab process and the months that follow it are not linear. You know what I mean? It's not straight up uphill. You know what I mean? Which sucks, right? But yeah, there's gonna be dips. There's gonna be times, especially if you're a high level athlete or you have a super demanding job. Like those things may cause discomfort at some point. It's there. It is. It's not a linear process, and that's okay, right? Like that's okay. What do you do about it, right? So I mean, you have a tool. So one of the things that we do at Redemption is we build your toolbox, right? You know, we build this program, whereas it gets you out of pain, it gets you the foundations and whatnot, but it's something that you can come back to if you need to.
Hmm.
You know what I mean? So if you start to have a little bit of an achy knee, all right, let's hit these exercises back up, right? And knock it out before it
Hmm.
becomes a problem,
Right.
right? The other question is like I think we mentioned this earlier was like these might be exercises that you're able to just throw into your warm up for the rest of your career.
Yeah.
Like, what's so wrong about that?
Yeah.
You know what I mean? Like so yes, they go from therapeutic exercises to just a warm up.
Yeah.
You got to warm up anyways, or you should be warming up anyways, right? So what's wrong with that? Just keep the exercise. If you know they work and they're doing you good, don't stop them,
Yeah.
right? You know that's another thing. And then like we
Mm.
just talked about, sometimes like I just had a client the other day, and he was like, he's like, "Do you mind if we do dry needling on my knee after the session?" He's like, "It's a little achy," and I was like, "Okay." And then I talking to him, I was like, "Why? Well, like, what's going on? Like, why do we think it's achy?" Blah blah. And he's like, "You know what?" He's like, "I know what it is." He's like, I work near this like coffee shop, and they have these coffees, but it's like Dunkin' Donut coffee, so it's like high
Oh
sugar, right?"
gosh.
He's like, and I hadn't been drinking them, and like I had a couple this week, and he's like, and now my knee, he's like, it's got to be the sugar, and I was like,
Boom.
Probably, because he has not had any knee pain, and you know what I mean.
Yeah.
And he's like, and the week that he started drinking these again, he just slipped a little, and it's
I
caused
love
knee
that.
pain. Yeah,
I love that. Not that he has knee pain,
right.
but I love that because it's the awareness.
Yeah, I was so proud of him too.
That is huge.
Yeah.
It's huge to literally looking at the whole picture,
Hmm.
right? Not just looking at, oh, knee pain, movement issue. Let me do some stretches. Let me do an exercise to feel better.
Hmm.
Or put some ice or heat, or you do something on me and I feel better. It's more, oh, I had that sugar bomb over
Right.
there and this week, and I haven't had them in a while, and sure enough the knee pain came back.
Hmm.
Boom. Okay, that now we made a connection between what we consume and how our body
Right.
functions.
And how simple? How simple is it?
Yeah.
Like, just don't drink those.
Yeah.
I mean,
Yeah.
to some people, they're like, but I need. No, you don't.
I
No, yeah,
need
you do not. Just don't drink those.
it.
Let's go
Look.
with a better option.
Yeah.
You know,
Yeah.
that you can still have caffeine. I'm okay. I have caffeine,
Yeah.
right? But there's better options.
Right. Right. We're not trying to be perfect here. And good gracious, we're not perfect.
No.
But we're saying that it's more about just making those modifications, especially if you know it's ruining like the way that you feel and perform.
Mm-hmm.
Right?
Yeah.
If it's ruining the way that you feel and perform, you can make a connection there. All right, now let's address that thing.
Yep.
if it was easy for you to do that for that extended period of time, and then, you just decided, huh? Like, I get it if you decide just every now and again to dabble in
Yeah, you
something.
gotta live life.
That's cool.
Damn, you gotta live.
Whatever.
Yeah.
Yeah. But if you're just like, "Oh, I'm just gonna go back to completely doing what I want and, whatever," then that's on you. We're not talking to
Yeah.
you. But
You get
anyway.
no toolbox.
But anyway, the point is the awareness piece, like
Yeah.
understanding, looking at everything else outside of it and being like, "Oh, man, you know what? I did do that.
Right.
Oh, this week has been really bad with sleep. That's why."
Mhm.
Stuff like that. That is
And it
huge.
was so cool to be an impact because, like, him and I have had this conversation before. He's a high level athlete. We've talked about the impact of sleep and nutrition and all these things. Like,
Mhm.
it was cool to like, I want redemption to be like a lifestyle
Yeah.
business, right? Like, like we said, I want you to be able to use me for the rest of your life, to have
Mhm.
this toolbox for the rest of your life. And it was such a cool thing that like you said, the light bulb went off. He was like, "Shit, that drink has so much sugar in it, and I bet you that's why." And I was like, "That like those are the skills. Like those are also the skills that I want to teach you." You know what I mean?
Yes.
Because I don't
Yes.
want to just teach you how to do a Spanish squat.
Mhm.
You know, like I
Yeah.
want to teach you how to manage your shit for the rest of your life, so that you
Yes.
can live a long, healthy, happy life.
Yeah, so huge, so
Yeah,
huge.
it was cool. It was cool.
Yeah, that I
It
mean,
was fun.
yeah,
I was
well,
so
yeah.
proud.
Oh, that's great. I
Yeah.
love that. Obviously, I love that stuff because people are, now they're more empowered.
Yeah.
We'll put it that way instead of
Exactly.
dependent. And I think I'll just put it out there. I don't think there's anybody who doesn't want to feel empowered
No.
to be able to take care of themselves.
Right.
So when you see that, people are actually giving you tools not only for exercise and movement based, but also other things outside of that. And they're asking these questions. Understand that we're investigating. I mean, we're just gonna keep this as real as possible. Like we ran out of we ran out of memory on the video, but we still got audio. So that's the good thing about having like two separate sources going at the same time.
Whoops.
Yeah, whoops. Sorry. So if you miss our lovely faces, I apologize. You're just gonna have to hear our voices right now. But back to the main point about just the idea of it being a holistic approach
Yep.
is huge. And yeah, we're just trying to give you the tools that if somebody pretty much is investigating all these things and they're making sure that you are sleeping and your stress is okay, and they really do care about getting you better. They really want to make sure the whole picture is clear, so that way you know exactly what you need to do to get out of pain and stay out of pain.
Mhm.
And if some freak accident happens, you know what? You already know what to do and who to go to.
Yep.
Yeah, do you have anything else to add?
No, I think we hit it.
Yeah, so yeah, if you have any other questions, if we did not hit some questions that you may have about physical therapy, then feel free to put them down in the comment section down below. Um yeah, and if you have some type of injury that you're dealing with right now and you want some guidance on that, go to redemptionphysicaltherapy.com, schedule a free phone call, and we'll get to you and try and help you through your hard time with your injury, okay? To get you on the other side of pain and back to performing the best way that you possibly can, okay? So, thanks again for listening and watching for the time that we had you watching. And we'll see you in the next one.
Peace sign.
Peace sign.